Let's talk just a couple of minutes about the utilization of indirect calorimetry for calculation of nutritional goals and its effect in ventilator-free days and muscle thickness in septic mechanically ventilated patients. Overfeeding and underfeeding mechanically ventilated patients has been associated with prolonged ventilator and ICU stay. It's well established that predictive equations for determining energy needs are inaccurate and unreliable. Evidence-based guidelines consistently recommend the use of indirect calorimetry as the gold standard for determining true caloric needs. However, whether utilization of indirect calorimetry actually improving clinical outcomes is currently unknown. The combination of low caloric intake and muscle atrophy results in prolonged mechanical ventilation and reduced physical function, contributing to the development and functional decline of post-ICU syndrome. Our research team is comprised of an interdisciplinary group of physicians, respiratory therapists, and registered dietitians at Baylor University Medical Center in Dallas, Texas, under the guidance of our principal investigator, Dr. Mojakamian. Our research outcome and goal of this project is to assess if utilization of indirect calorimetry versus the predicted Penn State equation for caloric delivery results in the improvement in ventilator-free days, as well as muscular structure in septic patients. Our primary outcome of interest is ventilator-free days, with our secondary outcomes as being assessment of muscular structure, specifically diaphragmatic and quadricep muscle thickness. Our methods and research protocol will randomize septic ventilated patients to receive nutrition support administered based on calculations from indirect calorimetry or to receive nutrition based on the predicted Penn State equation. Our research will utilize sonographic technology in two innovative ways by obtaining a baseline and twice-weekly measurement of muscle thickness from the quadricep muscle and the diaphragm. Adequate financial support will improve the overall organization, quality, and execution of the study by providing the means to have a dedicated study coordinator to manage the project and support a biostatistician to complete required statistical analysis. The results of our study could have significant impact on ICU patient care, including improving the quality of care and reducing cost of care, with the potential of reducing ICU and hospital length of stay, while also contributing to a gap in the literature to understand the role of indirect calorimetry in patient outcomes and the relationship between muscle thickness and mechanical ventilation duration.